Good afternoon, and thank you for joining us this afternoon. And most importantly, thank you for practicing social distancing. My name is Jory Pritchard Kerr. I am the interim media liaison in Lisa Winkelschoten's absence. I will shortly be bringing on Nora Holder, who will read a prepared statement, and then we'll take some questions afterwards. Nora Holder's name is spelled Norahholder. She is the president and CEO of the Collingwood General and Marine Hospital. So we'll hold for just a moment while we bring Nora in. Thank you. Yep.
Good afternoon. CGMH received notification March 19th of its first lab-confirmed COVID-19 case. A local man in his 50s recently returned from out of country and presented to CGMH's emergency department on March the 13th. Our emergency department team engaged in the necessary processes and precautions to ensure the safety of employees and other patients. The patient was quickly isolated and cared for by a team wearing full protective equipment. After being assessed and tested in the ED, it was determined the patient did not require further medical treatment and was discharged home to self-isolate as per Public Health Ontario guidance documents. Our excellent employees and physicians were well prepared to care for this patient, and I want to assure you that CGMH is very safe for employees, physicians, volunteers, and patients. It is important to note that many patients who test positive for COVID-19 will not require hospitalization. Inpatient hospital beds must also be available for patients who are suffering from other non-COVID related conditions. Self-isolation at home, following strict public health guidelines, will be appropriate for a large number of these patients who will be confirmed in the coming days and weeks. CGMH has implemented many directives, protocols, and best practices to ensure safety during this time of heightened COVID-19 activity, including the following. Patients are screened for travel history and symptoms of illness. Entry points to the building have been limited. Infection prevention and control protocols and procedures are robust, with ongoing education and support. Visitor restrictions are in place. Enhanced cleaning continues in busy, high-touch areas. We continue to follow the guidance of the Ministry of Health and Public Health related to testing only those patients that meet the testing directive. I would like to thank everyone on the Collingwood General and Marine team who continue to follow best practices to provide care in this environment of COVID-19. In particular, I would like to recognize those working in the assessment center and emergency department to ensure patients are screened, assessed, and tested as appropriate. At this time of global pandemic, every employee at Collingwood General and Marine Hospital is playing their own critical role in the health and safety of our patients and our community. The COVID situation is fluid, with new information and cases being announced every day. We anticipate that this is only our first confirmed case of COVID-19, and in the days and weeks to come, others will be confirmed. We again ask the public to help limit the spread of COVID-19 by practicing others, coughing and sneezing into your elbow, staying home when unwell, avoid all non-essential outings in public places, and undertake vigorous and frequent hand washing while also caring for your hands. For those who have offered support of food and care packages. You have our thanks. Unfortunately, we don't have the resources to accept these gestures safely at this time. Messages of appreciation on social media, notes to friends, families, and neighbors who are healthcare workers, to healthcare workers, or donations to our foundation are extremely helpful and appreciated. I have the greatest confidence in every CGMH employee and physician. They have the experience, knowledge, and skills to help us successfully navigate through this COVID-19 global pandemic. Our South Georgian Bay community is so very fortunate to have such a dedicated team. Thank you for your attention, and I'm prepared to take some questions now.
Hey, Nora, it's Ian at the Connection.
Hi, Ian.
Hi, just making sure you can hear me for one thing. So when you talk about this gentleman being, just trying to figure out exactly how he sort of met that threshold of where he needed to be or could be tested. I'm trying to understand that.
Right. So there are testing criteria. The criteria is you need to have traveled outside the country and have experienced coughing and other symptoms that are pretty severe or of a moderate nature, and out of the country within the last 14 days. And that screening criteria, Ian, is on our website.
The assessment center exhibiting those symptoms, but I hadn't been out of country. That would mean I wouldn't get a test. I don't meet that threshold, or because that's something I'm seeing on social media, quite frankly.
Yeah, the criteria right now on the website and the directive from the Ministry of Public Health, it's travel related and the other symptoms.
Okay.
Or anyways, if you go on the website, you'll find it.
Okay. I'm just thinking in terms of obviously the testing and you know, the test kits, as I understand it, are sort of I guess rare, not rare, but I just wonder how you guys are set up for doing testing.
We're set up pretty good. We've got a great process going on. Come in the assessment center, you're assessed, and either you meet the criteria and you come into the ED to be tested, or you know, and you've got you have a mask on. There's a whole process. You don't meet the criteria, so for testing, but perhaps you've got, you know, symptoms that probably, if you monitor at home, you're okay. If your symptoms worsen, then you come back to the hospital and we provide you with information, what to do at home, how to self-isolate at home, how to ensure that you self-isolate and don't come into contact with others who are in your home. Yeah, the process is pretty clear and clean, and yeah, we're ready.
So this gentleman, he was in March 13th, correct?
Correct.
And then sent home. Who does the follow-up with him? Public health or?
Yes. Mm-hmm.
Okay.
Hi, Nora. It's Erica Engel calling from Collingwood today.
Hi, Erica.
Hi. I just getting a lot of people concerned because not everyone is getting tested, even if they are probable cases. What's the hospital's message to people looking for that kind of information?
So that information is on our website. We have a COVID-specific area that is actually quite prominent, and you'll find all the information that you require on the website. You can also contact public health or give telehealth a call. All of the criteria that's provided for testing at this time, knowing it can change, is provided on those websites, and they are valid, reliable websites.
Sorry, just further to that, I mean, the amount of people who possibly have it but aren't being tested at this time, or at least that's people's concerns. How would you address those concerns about people not being tested, but also possibly having the virus?
So people who come and they're assessed, and if they don't meet the criteria for testing, but they might be a probable case, they are asked to go home because they're healthy enough not to require entry into our emergency department. And they are asked to self-quarantine or isolate at home. And they're provided all of the directions in terms of to be successful in that endeavor. And if their symptoms worsen, they need to call telehealth, or they can come back and become assessed again. The vast majority of the cases don't require hospitalization, and there are many people across the province who right now are self-isolating or who are in quarantine for the full 14 days. And they're doing this successfully. And if they don't feel well, call telehealth or come back. We're happy to see you.
I just wonder,
Do you
Nora.
have any idea?
Go ahead, Erica.
Go ahead, Ian.
Oh.
Okay. Do you have any idea how many tests are actually happening at CGMH?
The number of tests, I have to say, they vary each day. We have a regular stream of patients now coming through the assessment center, and that information can actually be collected, can be obtained from public health. So suggest you go there right now.
So Nora, I want to go back to the previous comment where you're talking about people show up, they're assessed, they don't meet that testing criteria, but they're still sort of sent home because they have symptoms. Is there a protocol or some sort of process that information about that individual goes from you guys to public health so they at least know that there's a probable case?
Anyone who's asked to go into self-isolation, you know what, Ian, that's a really great question. I actually tell you, I can't answer that. I'm not in the tent, but you know what, we're happy to provide that to you. I'll be honest right now, I have not performed an assessment. So we will get that information to all of you who are on this call right away. Jory's writing it down. I apologize for that.
Yeah, like I said, I just wasn't sure how the information from the assessment tent, if it even goes to public health. So
yeah, that's a perfect question. That's my assumption, but I want to validate that for you. Okay.
I just wonder, in terms of the staff who may have come into contact with the gentleman from March 13th, is there any concern for those folks, or do those folks, they're basically gowned and masked when they were dealing with them the whole time? There's no contact issues there for your staff?
No concerns at all. None at all. We do a follow-up, and everybody was wearing full PPE. We're all engaged in all the right processes. Absolutely. I have no concerns, and neither does the hospital, occupational health. Not at all.
Okay, thanks.
Thank you.
Nora, I'm still berating that one point. When I asked public health about testing and how many tests are being done, they say they don't have that information.
Oh.
So I don't know if maybe you can follow up on that too with Jory.
We'll follow up with public health on that. How's that?
Okay. Yeah.
Okay,
thank you.
thanks, Erica. Okay. Happy to do that.
Yeah. That's all my questions.
Yeah, I may not always have the answers for you, but we're going to endeavor to try to get them to you as soon as possible. And yeah, and this is so fluid. Things are going to change. They'll be different tomorrow, and they'll be different in a week.
I just wonder, Nora, in terms of that gentleman and prior to his arrival at the hospital and people he may have come into contact with, I take it public health would do any kind of investigation. Is that correct?
Right. Yeah. Public health does an investigation. They do tracking. They've got line lists. They will have been in contact with him already and determined as soon as someone is tested, they would immediately start looking into that and contacting individuals. Absolutely. So there's no reason for anyone in the community to be alarmed. If you haven't been contacted by public health, you're not deemed at risk for anything in that regard.
Sorry, I may have missed it at the beginning of the discussion. Did you say what country he came out of? Or
No,
you have-
I'm saying out of country. This is a small community. It's not Toronto. So if I said a country, you wouldn't know. So I'm just saying out of country. I want to protect patient confidentiality. I'm sure you understand.
Do we know how his health is right now?
No, I don't. I'm assuming it's fine. He has not come back, Ian. Okay, I want to thank you all for the great questions. And for those I couldn't answer, we're going to get back to you as soon as we can. And you know what? I really appreciate your interest. And I really want to ask you, when you report, it's really important for our community to remain calm, to get messages, to understand that, we're not concerned. Your hospital's here, public health is here. And we're doing everything that we can in this circumstance. And you know what? If you see a healthcare worker, knock their elbow.
Thanks, Nora.
Thanks very much. Have a great day.
Thank you.
Okay, bye-bye.
Bye.